Thanks for coming, everybody. Welcome to another Healthy Gamer GG stream. My name is Alok Kanoja. Just a reminder that everything we discuss on stream today is intended to be for educational purposes only, and nothing is intended to be taken as medical advice. So if y'all have questions, concerns, please go see a licensed professional. Yeah, so welcome, everyone. Yeah, so we've got some cool stuff for you. So we've got an interview today with Justa Minx, who is an awesome streamer. So we're going to be talking with her a little bit about whatever she wants to talk about. And then we've also got some other cool things to kind of dive into. We're going to talk a lot about what's going on in Mental Health May. Just to give you all, no, it's not over. Just to give you all kind of a quick preview. So we've got a sleep hygiene, sleep kind of program going on our Discord to help people fix their sleep schedule. So if you're struggling to fix your sleep schedule, go ahead and hop on, check it out. We also have some room cleaning stuff going on. May 10th is National Clean Your Room Day. I don't know which nation. I don't know who made it National Clean Your Room Day, but that's what it is. So that's what we're going to do. The sleep event is at 7 a.m. for me. Weird. We also have bot-hosted study sessions. And so we have lobbies and stuff where you can kind of chill out, like study some, get your work done. And so that's kind of like geared towards our students. And then we also have more networking events in our career sub-community. So if y'all are interested in like learning more about different aspects of careers, we have some networking events planned. And then we have more bot-guided meditations for focus, ADHD, and more. A couple of other announcements before we jump into the interview. The first is that all stream donations through Mental Health May go to the Healthy Gamer Foundation. And so what we're really trying to do is adapt to an evolving mental health needs landscape. So the mental health needs of the digital generation are changing, and we're trying to help y'all with that. And then the last thing is 100% of our profits from the Healthy Gamer merch store actually go to the foundation this month. So, yeah. And then we also have a new type of coaching that we're going to be talking about at the end. So one of the things that we've noticed is that as our community has grown, the coaching needs of our community have grown. And so we're going to be sharing with y'all some info about career coaching. And we'll show you kind of what that is towards the end. So I think it's going to be very cool. We're very excited about it. And the pilot is going really, really well. So stay tuned if y'all are interested for that, okay? So let's hop into an interview. Okay. Let's do this. Wait a minute. Okay. Testing? Can you hear me?
Hello? Yes, I can hear you.
Okay, let me fix my camera. Oh, all right, let me do this. That shouldn't matter. That should be better. And then give me just a second because it sometimes takes me a while because I'm a little bit of a boomer.
No, take your time. We struggle with that.
Let me make sure I'm doing this right. And then, boom. There we go. Hello.
Hello.
Welcome.
Thanks for having me.
Can you do me a quick favor, Minx,
Yes.
and count to 10?
Actually, hold on. Let me turn up my mic real quick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank you so much. Welcome.
Thanks. Thanks for having me.
Oh, thanks. Thank you very much for coming on. I know sometimes it makes people kind of like nervous, anxious to be on, and we really appreciate you.
Yeah,
Coming
no,
on.
I'm excited. I'm excited.
And can you tell me first, what do you go by, or what would you like to be called today?
Minx works.
Okay. And is
Yeah.
there something in particular that you wanted to talk about, or anything that we could potentially help you with?
Well, nah, there's so much things I need help with where there's not specific.
Sure.
I'm kind of nervous. I don't even know what I should say first. Maybe,
Abs-
maybe, yeah, maybe even if chat, you push me how to start. I'm like, this is kind
no,
of new for me.
yeah, absolutely. So we don't ever want to push you, right?
Mm-hmm.
Okay.
Mm-hmm.
So, but we can absolutely get started. And maybe what I can do is sort of like take the lead if that makes you a little bit more
Yeah.
comfortable. So, first
Yes,
thing that
please.
I want to point out is that a lot of times, if we're thinking about what we want to work on, there are like so many different things and they're all like tangled together.
Mm-hmm.
And so it can feel like we don't even know where to start. Is that kind of what you're feeling?
Yeah, pretty much every single day of my life.
Every single day. Wow, that sounds. How do you deal
Well,
with that?
not when when I take my Adderall is what I do, and then I'm straight ahead, focus on what I need to do.
Wow. So it sounds like Adderall really helps you.
I also think that it doesn't help me as much as I think it does. I think every time it's like a mental thing, similar to in the past when I used alcohol as a like because I was shy or anxious,
Mhm.
where I could have one shot and then I'd be like social for the night when realistically it's just a brain thing,
Yeah.
probably.
So I'm almost hearing that the Adderall changes your sense of confidence more than it actually changes your brain. And you're like, now
Yeah,
that I've
it
taken
just
Adderall, I can
yeah,
work.
I feel like if I take it, I'm like, I know I have to work because I'm like, it's prescription, it's prescribed. So I'm like,
Yeah.
once it's there, it's like, well, now I have to work. I can't just doss around and do nothing.
Yeah, absolutely. Can I share with you kind of an interesting study I read recently about medication for ADHD?
Yes.
So they did an interesting study on kids with ADHD and parenting styles of kids with ADHD. So what they found is that when a kid has ADHD, it's very, very frustrating for the parent. And the parent actually will like yell a lot more when their child has ADHD. So kids with ADHD have this thing called passive noncompliance, where their focus is like so big on a particular thing that the parent is kind of like talking to them and saying, "Hey, it's time to go to school. It's time to go to school. It's time to go to school." And the kid just isn't paying attention. Like that's what ADHD is, right? It's a problem with attention.
Mm-hmm.
And then eventually what happens is the parent yells at the kid. And then the kid gets yelled at. They get kind of snapped out of like what they were doing. Parent is kind of frustrated and angry, and then the kid listens, and then over time the parent actually learns to like yell more often because that's what it takes to get a kid to listen. You with me so far?
Yeah.
So the weird thing is that when you give the kid the medication and you actually test in a laboratory their ability to focus, it does not change at all. But what changes is the parent's behavior once a child is medicated. And we're not quite sure how that works. But something about the medication allows kids to listen to their parents better, even though their inattention score does not change. So their ability to focus doesn't change, but it's weird. So it definitely does change something. It improves their symptoms. Like, so if you look at like them getting in trouble at school, them doing their homework, them being late to school, it improves all of the outcomes that ADHD sort of causes. Like it causes people to be spacey, causes them to be late, causes them to be disorganized. So it fixes all those things, but it doesn't actually change their mind's ability to like focus. And we don't quite know why that is, but it's really interesting.
What the hell? No, that makes sense. Because I was like, because so ADHD medication in Ireland, like in Ireland, when I was being diagnosed, like it took me months to get diagnosed with BPD. And I was like in the process of being diagnosed with ADHD for months. And then I came to America and I was like, oh, I'll continue with, but I had to restart. And I was diagnosed within 2 weeks, which is insane to me how quick it is over here. And then we don't even have Adderall in Ireland. I think it's I don't even know what we have because I was never on the medication. But like they just threw Adderall at me immediately, and I thought that fixed everything. But exactly what you said there, where I did a test with it where I was like, I'm doing nothing today, and I had it, and I think it was more a mental thing where I was like, I should work because I've had it, but realistically, I was able to lie. It's weird.
Yeah, tell me more about that. That sounds so. I'd love to hear kind of your experience of that if you feel comfortable sharing.
It's just I think I've always like I kind of have a fear of Adderall if that makes sense because it's not necessarily banned in Ireland. We just don't have it. and like it's just talked about a lot where it like makes you almost like you're just ooh, energy, energy, energy. So I was always
Yeah.
scared of it where I'm on 15 mg twice a day, but I don't take that. I like break it in half and do 7.5, and then if I need more of it, but then like if I take one whole pill, even though it doesn't make a big difference, in my head I'm like, whoa, bro, I'm so focused right now. But it does feel like a lot of the time it's more me telling myself I'm focused than actually feeling focused. But now I feel like reliant on it when I need to do work. Like if I need to sit and do meetings and stuff, I like have to, take an Adderall, which is kind of annoying because I've had ADHD my whole life and I was able to, you know, survive without it until I came to America, but now I feel like I couldn't survive without it.
You can't survive without
Not
it.
survive, but like do my work with it. Like I couldn't like I feel like now I can't like go through emails for 3 hours or like do all that
Well,
without it.
yeah, I mean, I think going through emails for 3 hours without it sounds terrible for anyone, let
That's
alone
true. You got me there actually.
because I'm wondering then if it's just that it's not that. How can I say this? I know it's kind of weird because that's your experience and I don't want to disagree with it. But what I'm wondering is whether you're just like doing more now, like whether your plate is just stacked higher with like stuff to do.
That actually could be it too, because to be fair, when I was in Ireland, it was just me, myself, and I in a little renovated morgue, and here I'm like living with roommates and going out consistently because LA. So that
Yeah,
might be it too.
yeah. So how are you feeling now? By the way, are you okay talking about this? You feeling like nervous, or does this feel okay?
No, I actually feel fine talking about it because I usually don't get to talk about like this stuff on my stream at all.
Yeah, can I'm just so curious. I'd love to learn more about your experience because you mentioned in Ireland it took like you were getting diagnosed for months,
Yeah.
and can you tell me a little bit about what that was like?
Yeah, so I never actually got diagnosed in Ireland with ADHD. I was like going through a bunch of tests, and it was similar where, to be fair, a lot of the time I wasn't making myself to go to the appointments like every 2 weeks or week because I'm like, it's taken forever. Like with my BPD, it took like I think 9 months to get properly diagnosed because they didn't want to mess up the diagnosis and
And
stuff.
and can you help us understand what BPD is?
It's like borderline personality disorder. It's honestly hard to explain. It really has a bad rep. Um, but I personally like think it helps me with my content because if I'm like having a really bad mood swing that I can't control, I throw it into like, acting, where it's like a lot of my crazy bits come from that. But it took months where it felt treacherous. And honestly, that's my question. I'm like, America's so quick with diagnosis where I'm like, are they misdiagnosis or is Ireland just so slow that it took months to diagnose?
What do you think? You've been evaluated in both places. Who do you think is doing better?
Uh, so honestly, I like how America was so quick because I feel like I've always known I've had ADHD and it was taking months. Like I've always been aware of that, but I've never like had the proper diagnosis except for when I was 16, but like they threw that out the window because Temple Street is weird. It's a weird Dublin hospital. Um, but at the same time, I also worry about how quick they diagnose you with it. Like my ADHD was like three phone calls, not even meeting me in person, or like three phone calls on a questionnaire. While in Ireland, it was like I had to meet Amy in person every week and do different like tests and stuff, and like before I got like diagnosed with anything.
Yeah, so I'm I'm happy to share some thoughts on that, but I just want to make sure we're kind of like okay with talking about this. So I'm going to ask you one or two questions that are like cuz you're sharing your experience of diagnosis and I may
Hmm.
be able to shed some light on that, but I want to ask you one or two questions that are like a little bit more medical. Is that okay? Like you
Yeah,
recognize we're on the internet and stuff like that, right?
yeah,
So
yeah.
when you were in Ireland, were you being evaluated for BPD or evaluated for ADHD?
So I was diagnosed with BPD 2 years ago, but it took months. But when I was in Ireland before I came to America, I was in the middle of an evaluation for ADHD. That was ongoing for about, it was somewhere between 4 to 6 months.
So did they get
Um,
sidetracked from the ADHD and went into the BPD?
No, so I was diagnosed with BPD first before anything.
Uh-huh.
And then I like brought up, like, Amy was just asking, she was like, have you ever looked into ADHD? And I explained how, like, at 16, I was like being evaluated for it, but with my epilepsy, for some reason, they just kind of threw that to the side.
Hmm.
So then she started the diagnosis for my ADHD, but it was like 4 months of like different kind of tests and stuff. But to be fair, this was also like free healthcare. Like what I've noticed is like, yeah, you pay for a lot in America, but like they're quicker with what they do half the time.
So yeah, so here's what I'd share. So I think a lot of times the amount of time it takes to diagnose different psychiatric things is different.
Yeah.
So BPD is borderline personality disorder, which sounds like devastating. Like if you have a disorder in your personality,
Yeah.
you're screwed for life. And by the way, your experience is not uncommon. So I do think a couple things. I feel like we got to talk about BPD for a second. So the first is that I think BPD gets a very, very bad rap. I think the second thing is that a lot of very, very high functioning and successful women have BPD. It's
Thank you.
it's just facts. So a lot of the women that I've worked with who have BPD are also very, very successful and very high functioning. And something about it, I think, is similar to what you're saying, where they're like something about it like makes them, and we could theorize more. I could share what my thoughts are on that if you're curious about that. But make something about how sensitive they are to criticism and how careful they are about like it's so damn important to do a good job if you've got BPD. That's been my
Yeah,
experience of sitting with people who have it.
I'm like honestly definitely interested in hearing more about BPD from you because in Ireland, like it was very, very like it's I feel like it's not as not common, but like my first therapist, like she almost misdiagnosed me with m- uh minor sociopathic tendencies, which when I went to Amy, my new one, she was like, that is not like nowhere near you. Why would she say that? Because like BPD is so like I guess it's not uncommon. It's just I feel like not really spoken about a lot. And then like they just put me on the same like Lamictal mood disorder pills for it, but here in America they won't give me my damn prescription.
D- are you joking about being frustrated about that, or are you actually frustrated? I can't tell.
It's just kind of annoying because they won't give me it. They're like, "No, this is an Irish prescription," and I'm like, "Mate, you gave me Adderall within 2 weeks, and you can't see my name is on these papers."
And they don't want to prescribe it?
No, they don't.
Do they think you? Do you mind if I ask some questions? Like, not so much about your diagnosis and stuff, but what's that like in terms of like, what have you explained to them? What do they understand? Do they not think that you need it? Do they disagree? What?
They want me to go through another like they want me to they want to re-diagnose me because they said like Lamictal is one of the minor ones. They think I should be on like I don't know what the pill is called. It's like a mix between depressive and mood disorder one. So they want to kind of completely restart from the beginning, do a fresh diagnosis that isn't from, Ireland, and then give me something. But I don't want to go through that. I just want my goddamn Lamictal.
And so it sounds like Lamictal helps you.
It's once again the kind of thing where it might it maybe I overthink that it helps me and it doesn't help me because that's what my mom every time I call her having a little breakdown she's like get back on your Lamictal and I'm like mother I cannot America is keeping it away from me.
That's so weird. So they're really quick to diagnose ADHD, and not so quick to That's strange, right? Because Adderall is a controlled substance. It's a stimulant. Back when I
Uh-huh.
was in residency, 1 month supply of Adderall you could sell for $1,000 in Boston. That was the street value.
Hey, I'm gonna be keeping that. I ain't
I
taking
don't know.
Adderall
I don't know.
anymore.
I don't know if it's still the case, but that's what
And I'm gonna be rich.
that's just what I heard from my patients who were testing positive. Like I'd be working in the emergency room and someone comes in, they test positive for Adderall, they don't have a prescription. I'm like,
You heard that, huh? Huh? You heard that? Word on the
Yeah.
street, it goes for
Word-
1K a pop. I
Yeah.
see you.
Yeah.
Don't worry.
Mix, you are awesome to talk to.
Oh, thank you. I needed that. I needed that.
No, seriously. It's been a long time since someone implied that I was selling drugs on the street. It's been many, many years.
Now I didn't imply it. See the wink? It
No,
doesn't-
I
I'm
know,
just
I
saying
know, I
didn't-
know. That's me projecting, right? I'm reading into
Yeah.
it. It's actually completely neutral.
Now
And
you've
that's-
admitted to your own
yeah,
fault.
it-
I can't help you here. Okay?
Well done, well
if the
done.
Pope will come for you.
I've been checkmated.
Actual self snitcher.
Anyway, what were we talking about? Oh yeah. So yeah, I think so. Let's just talk about the diagnosis of BPD for a second. And I can pull out the iPad and draw if that helps at some point. Okay. If I'm saying things that are like hard to follow without visuals, because I know also sometimes people with ADHD really, really benefit as being visual learners. So if that would help, just let me know. Okay.
See, I'll be real with you. It would help, but me admitting a drawing would help as a 25-year-old grown woman on the internet is kind of embarrassing. But yeah, pictures actually do help me pay more attention.
Oh yeah, so let's do it then, because I mean that has nothing to do with you being 25 years old. Like, drawings help all humans, and especially when it's like weird, confusing stuff. Okay, hold on a second. So this is gonna turn into a lecture. Are you okay with that? Like a little
Yeah.
one, and then
Yeah.
please ask questions.
Absolutely.
Okay, give me 1 second.
Yeah, take your
I
time.
gotta configure this. We're gonna do this. We're gonna do this. I need to do this. Okay. Okay, so Minx, I'm gonna need your help. All right.
Yes.
So here's what I need you to do. So I'm gonna give a lecture, but my class size is gonna be, hold on, is gonna be like kind of like 1, because you're the only person I can talk to right now.
Okay.
So what that means is that if I say something that doesn't make sense, you're the only person who can let me know.
Okay.
So what I'm going to need you to do is like pretend like I need the activity from you that I would get from 30 students sitting in a classroom. Can you see this, by the way? It's just going to be a black
Yes.
screen.
I can see it.
Okay, then we're going to do this. All right. So let's start. So you can see this, right?
Yeah.
Okay, so let's run through a couple of different things about your experience. The first is that, so there's BPD, there's ADHD. And a couple other things that we noticed is that it took you 6 months to get diagnosed in Ireland, 2 weeks in the US. Okay, so like what's going on here? How do we make psychiatric diagnoses?
So for BPD it was 9 months, but I was in the middle of 4 to 6 months for the ADHD, but never got fully diagnosed with it. And then I came to America and went to continue it, and then it was just 2 weeks off the bat.
Beautiful. Beautiful in the sense I love that level of participation. Okay. Oh, sorry. You said 2 weeks, right? Is how long it took you in the US?
Yeah.
Okay. So let's first talk about how these diagnoses are different. So has anyone explained to you, or do you understand what the difference between a personality disorder and a non-personality disorder are?
Personality disorders in your brain and cannot be fixed with meds.
Very, very good answer. Yeah. So we have this thing called a personality, right? And our personality is sort of like the way that we perceive the world and also the way that we react to it. So it's like, if you think about what's the difference between two people's personality, it's like, if both of us show up to a party, the situation is exactly the same, but the way that we'll perceive the situation, is everyone like looking at me and making fun of what I'm wearing? Or, oh yeah, this is awesome. Like everyone's so excited to see me. Like, even though everyone's sort of acting the same way, two different people could perceive it differently. And then the way that we respond to that situation also changes. Does that make sense?
Yeah.
Okay. So personality disorders also tend to be like developed early on. So our brain like develops like a way of interacting with the world. And then that pattern of like how we perceive and how we behave is sort of who we are. And then if that gets laid down in a particular way that causes us suffering or some kind of impairment in function, if it causes problems, we call it a personality disorder. Does that make sense?
Yeah, she do be causing problems.
Yep. And we'll talk a little bit about benefits of personality issues in a second. But so the key thing about the personality disorder is that if you look at a human being, let's say like this is your stress level. Your stress level
Can you
like
make
goes.
that chart a tiny bit bigger? We're
Sure.
talking about my stress levels, like huge.
Oh,
To the moon and back. Yep.
okay.
More
We'll do
realistic
that.
chart there. Stress levels want to get that peak going. Like,
Okay.
hey, no, the line never goes down.
Oh, we'll
There we
talk about
go.
that. We'll talk about how the line never goes down.
There we go.
Ooh, this is going to be good. Okay. Don't let me forget about that, okay, Minx?
Okay.
So the key thing about personality disorders, generally speaking, are supposed to take a long time to diagnose. And the reason for that is that if I'm stressed out, I'm going to be behaving in like a more impaired way, right? If I'm going through a temporary period of stress, I'll be lashing out at people. My mood will be more irritable. I'll have difficulty sleeping. I'll feel bad about myself. Does that make sense? But it's just like, it's like stress. So let's say like finals time, for example, or if someone, loses their job, or if there's a death in the family, or you have a breakup or something like that. There are all kinds of temporary things that will make you feel worse, cause problems, and impair function. With me? So the reason that we need time to diagnose a personality disorder is if we look at like, let's say, someone without a personality disorder. Dude, Minx, you're so good at this. Because this is what someone with a non-personality disorder may look like. Or,
those lucky.
yeah, they certainly are. Or actually, that's probably a better thing. So they may have, so if you look at just one point in time, if we look at like this 1 month period for someone with a personality disorder and without a personality disorder, it actually looks the same. That's why we need a lot of time, because is this your base? Like, is this just is it part of your personality, or is it a temporary effect due to stress? Does that make sense?
That makes a lot of sense, actually. Yeah.
Okay. So this is why, generally speaking, it takes months. It's supposed to take about 6 months
Okay. Right.
to diagnose a personality disorder, because you need to see people through the ups and downs. You need ups and you need downs. And when you kind of like remove the ups and downs of temporary stress from the equation, what you're left with is like their general way of functioning, their default way of perceiving and behaving. Does that make sense?
That actually makes so much sense, because I was so confused why it was taking so long. 9 months for something that, isn't even fully medicated. I thought they were just dossing around, but that actually makes so much sense, because everyone has stress. Everyone has different level. Oh my God.
Yeah. So
Yeah, you're so smart.
I don't know about that. I think you're helping me a lot here. This was all you, Minx. This is all you. So we're going to do it together, okay?
Yes.
Okay. So now let's talk about medication. So I know it sounds kind of weird. Okay, I'm going to ask you questions, Minx, but I think don't worry about giving me the right answer. I just need someone to interact with. And you, unfortunately, are the person on stream. So what does medication do? What do you think it does? I know it's kind of weird.
It's supposed to help
Yeah. And how do you think it helps?
by calming my mind when I'm about to blow up from something so small that it doesn't matter.
Yep. Very good. Okay. So, like, if we think about a medication, like when you take Adderall, like that's a physical pill, right? How do you think, and our mind is not physical, right? So how do you think, what does the Adderall do? Where does it go in your body and what does it act on?
My God, my stomach.
Okay.
Wait, what the hell? No, now I'm getting freaked out. Okay.
No,
What does Adderall do?
You're
How
good.
does it affect me?
Yeah, you're good. Good. Where does it go after the stomach?
Out my asshole.
If it just
What?
Okay, so it gets absorbed to the bloodstream,
Okay.
right? It gets digested,
Yes.
and then it goes to your brain.
Okay. Okay. 2 different answers there, but I was pretty close.
This is great. Oh my god. This is so much better than teaching at Harvard Medical School. Let me tell you what. Oh my god, I would still be there if I had students like you. Okay. And then it does stuff to your neurotransmitters, right? This is
To my what?
your neurotransmitters. Have you heard of these?
Yeah.
Like, have you heard of like serotonin and like
Yes.
dopamine and all
Yes.
this crap? Like we have
Wait,
these-
okay, so what's the difference between serotonin and dopamine?
Great
I
question.
thought serotonin was like happiness, but I think I was wrong with that.
Yeah, so this is where so here's the thing to understand about neurotransmitters. So we have things like dopamine, we have things like serotonin, we also have noradrenaline, let's say. So the thing to understand is that neurotransmitters are like letters of the alphabet. So like if I have A, C, and T, I can put these together to form cat or tack or whatever. They're just signals. And so what they do depends on like how you arrange them and what part of the brain they're in. So people think that dopamine is, for example, like the happiness neurotransmitter, or serotonin is the happiness neurotransmitter. But dopamine, for example, governs reward. So when you do something that's fun and your brain is like, ooh, I want more of that, that's governed by dopamine. But dopamine also does things like smooth movement. So for example, like if I wave my hand up and down, my ability to control that is actually due to dopamine. So they
What?
do, yeah, it's kind of all kinds of weird things. So serotonin also governs like whether you have diarrhea or not in the GI system. So well
What?
said. So you were right about it goes out the asshole. That's all. Adderall
you.
will stimulate that too. Adderall will actually affect your appetite, right? So I don't know if you've
Yes.
experienced that.
Yes.
So we gotta be clear.
That's why
We
I
gotta
like
be
about
clear.
Adderall. Lost me a nice little 15 pounds on that pill. I'll
Yeah,
tell you
right. So
that
it
now.
actually does all kinds of stuff. So neurotransmitters do all sorts of things. And generally speaking, people have a simplistic view of them. So this involves GI health in your GI tract. This also includes motor stuff. So there are all kinds of different neurotransmitters do all sorts of different stuff. It just depends on where it is. So it's kind of like a building block. It's just a chemical signal in the brain. But like, where that signal is and what's receiving it will determine what it does. Right? So like, let me just, I'm trying to think, this is going to be a terrible analogy, okay? So
Yeah.
if someone, let's say I'm lying in bed at night and someone puts their arm around me and says, I love you, that signal means very different things, whether I'm at home and in bed with my wife versus I'm sleeping in a hotel room on my own. Right?
Well, if you're on your own, that's a ghost, mate.
Yeah,
Who's
that's what I'm
saying I
saying.
lo-
Exactly, right? So even though the stimulus is exactly the same, the meaning of it and the effect of it is completely different. Because one is comforting and one is terrifying. Even though technically the words are the same, the feeling is the same. You with me?
Yeah, ew.
Right. It's a terrible analogy. But okay. So that's where these neurotransmitters are just different chemical signals in the brain and what they govern. So serotonin, like people think about serotonin as happiness because when someone has something like major depressive disorder or MDD, and we give them a serotonin boosting agent, what we find is that their depression gets better. So their depression goes down and they feel better. So what we sort of do is we assume that a serotonin deficiency is causing depression. Does that make
Okay.
sense?
Yes.
But
Yes.
it's not, I mean, serotonin does a lot more than that.
Okay, and it's dopamine that Adderall helps.
Oh, yeah. So
God damn it, they're so confusing. They're both like the same thing, but different.
oh, yeah. No, it gets even more confusing. Like, so here's the way that, let me just think about whether I want to go into this. So a couple
Wait, is
of
that
things.
why MDMA is called? Because MDMA? Isn't MDMA like happiness?
No, I don't think those are related.
Okay.
So MDMA gives people a sense of connection. So it does help with potentially MDD, but you're right.
Okay,
but
so
for the wrong reasons.
are those like drugs then? Like they boost your dopamine?
Nope. So
Dopamine?
let's talk about MDD. So this is depression, and MDMA. Okay. Let's talk about how this works. So MDMA, which I do not recommend people use, is also called ecstasy, right?
Yeah.
And generally speaking, makes people feel very connected to each other, right?
What the hell?
I, I, I don't know. I've never tried it, but that's what I hear. So let's talk a little bit about.
Sure, Doc.
Well said, Vince. Okay. So let's talk about depression. So in depression, what people get stuck on is thinking about themselves in a negative way. So when I'm depressed, I'm just thinking, oh my God, like I'm such a terrible person. Everyone else would be so much better without me. You know, like my family would be happier if I wasn't around. They think all these like weird, bizarre thoughts. I don't know if you've experienced that or if you have friends like, are you kind of, people feel that way in depression? They always like think bad about themselves.
No, consistently.
So what happens here is we have this part of the brain called the default mode network. And I know the acronyms are getting crazy here, but the default mode network is the part of our brain that thinks about us. So this is what separates humans from animals, right? So animals don't think about themselves. We think about ourselves. And when everything in our life becomes all about me, but in a bad way, we get stuck thinking about ourselves. I can't think about something else. I can't just sit outside and enjoy the sun because all I'm thinking about, my mind is like, it's stuck on this thought that I'm a worthless person. With
Do
me?
monkeys DMIU?
Huh?
Do monkeys have it? Aren't monkeys the closest to humans?
So they may have a very primitive default mode network, but I don't think it's nearly as developed as ours.
Really?
So we're basically stuck thinking about ourselves. And so if I had to hypothesize how MDMA can help, is that, remember, MDMA creates a sense of connectedness. So I think it kind of stops this action of the default mode network where all we're thinking about is ourselves. We're able to start thinking about other people and like connecting with other people. And there are even studies that show that some of these drugs, which are now being used as treatments for depression, like ketamine, work.
Oh, I've heard about the ketamine treatment.
The ketamine actually shuts off the default mode network. So we've figured out how ketamine helps people with depression. And the really interesting thing is that ketamine is the fastest acting treatment for depression that we've ever discovered.
Okay, so I heard about it. My friend, she was telling me that she might be going for it, but in Ireland, ketamine is known as horse tranquilizer.
Sure. So ketamine is also used in anesthesia.
What the frick?
Yeah. So because what ketamine does is it kind of like, it's a dissociative agent. So we'll use it in anesthesia to like, if we're doing surgery on someone, because they kind of get like disconnected from themselves.
What the hell? Why is everything the same? It all loops back in together. Ketamine is in anesthesia?
Yeah.
Damn,
that's
I
how
love anesthesia.
Well, yeah, I mean, you're not the only one, right? So if we look at other drugs for anesthesia, like nitrous oxide, people love that stuff too.
I don't know what that is.
That's like laughing gas.
Oh, okay. I thought that was anesthesia.
Yeah, it is anesthesia.
Okay.
Right?
Okay.
So a lot of the anesthetic agents can be drugs of abuse. And so you're right. It all like, yeah, I mean, it all, yeah, Minx, you're right. It all connects.
Okay.
Shall we
And
go?
what about oxy?
Okay, oxy's an opiate. Okay.
Okay. Listen, do you know I had a run-in with oxy? So in Ireland, oxy's like banned. Completely banned. Here, I had like surgery last year, at the end of last year, and they gave me oxy. And I didn't even know anything about it, didn't know what it was. But I would like go live and I'd be like, yo, I'm feeling good. I'm feeling loopy. And then my mother, who was a nurse and a special needs assistant, once she found out I was on it, she was like, please get off that. Please, for me, get off that. It's addicting. And then I did get off it. Like I threw it away and stuff. But I didn't realize like it's a huge thing here in America.
Yeah. So a couple years ago, I'll tell you a story. So a couple years ago, I was talking with some people who were in the leadership of the American Psychiatric Association. And I was telling them, hey, I think technology addiction is a huge problem. I think that people are starting to get addicted to technology. I think it's causing a lot more problems than we realize. I think we need to take this a little bit more seriously. They were very, very nice and very supportive, but their response was, right now, this country is dying of opiates. Oxys are like killing people at an alarming rate, and we have to fix that problem first. And so it's really challenging, but what happened to you is very common where people like, because people who aren't that familiar with addiction are usually the ones prescribing Oxy, right? You'll get like surgery, or you'll go to the emergency room with like a sprain or something like that, and a surgeon will just prescribe Oxy because that's, you know, it works really well. And and oftentimes, like if you really think about it, you know, surgeons don't really sit down with you and ask you about like, you know, do you use drugs? Or will ask you, do you use drugs? And then you say no, and they're like, all right, here's a
I
prescription.
feel like a warning should be like in place though, because I had
Oh
no
yeah.
idea. I was just like, okay, this is going to like make me feel better after surgery. And like if my mom had not told me, because I'll be real, I was enjoying those pills. They were putting like making my pain go away, but I was also feeling like giddy. And
Oh
I'm like,
yeah.
I'm a mama's girl, and I trust her. The moment she asked me to stop, I stopped it, and I went on. Um, I think it was like Tylenol, which did not. It barely helped. Well, it's weird. It's weird.
Oh
Why do
yeah.
they give it out so easily? Especially like, I feel like, you know, I'm Irish. I have an Irish passport, not even a state. Like, they gave it so easily to me.
Yeah. So that's a complicated. That answer is complicated, but the short answer that I'd give you is that many, many years ago, when Oxy came out, the drug companies that made Oxy really, really pushed it and were probably not entirely honest about how addictive it was. But they probably knew that it was very addictive and knew that it was very effective. And so what they ended up doing is like sending a bunch of like pharmaceutical reps, and then it essentially like became the standard of practice in medicine very quickly. And so people just started like prescribing Oxy before they realized how bad it was. And now the problem is that it's so all over the place. Like you can think about it like almost like a smartphone, where like now like everyone has internet on their phone, and it's permeated the American medical system so heavily that it's really hard to like go back and like change things now. So it because a bunch of doctors just got trained in using it, right?
It's so weird.
Yeah, it's bad, man. And then
That's
like
so
now we have like
weird.
fentanyl,
Oh
and then
wait,
like
what?
people
Oh,
are
okay, I've heard of fentanyl. Actually, do you mind if I run to toilet? Sorry,
no,
I
go
drink
for
so
it.
much water. Thank you. I'll be right back.
Okay, I guess this is a Dr. K talks about different drugs stream. Yeah. Yeah. Oh, yeah. I know that we started off with the diagnosis of BPD. I didn't forget, but it's good. I mean, we can. It's important. So you know, she's saying that like I didn't know that Oxy was a problem, and like that. Why do y'all think we're talking about this now? Right? Because there's a very good chance that there are people out there right now that you're going to get dental surgery done. You're going to get like a tooth taken out, and your dentist will prescribe an opiate pain medication. And you may be one of the unlucky people that has a genetic predisposition to opiate addiction. And then it will transform your life. Like it'll be so amazing. It's going to help with the pain so much. Right? And so y'all need to know these things, because I don't know, you know, how many hours of education dentists get about like how to deal with addictions, how to screen for addictions. I'm sure they get trained. I mean, they obviously they know and must know that opiates can be addictive. There's no question about that. But it's just in terms of like, there's a difference between telling a dental student opiates are addictive and like really equipping them with the clinical skills to evaluate whether a particular patient is vulnerable to addiction. So, for example, I've been to the dentist a ton of times. No dentist has ever asked me, do I have a history of opiate addiction in my family? which is probably a question they should all ask before they prescribe it to you. Right? Like, but it's just not a big part of their training.
That's so crazy. Like, America's so... No offense, man. America's so insane.
Yeah.
Like, I feel like Ireland's on the other end of the shtick, though, where they refuse to, like, give out... Like, my older sister just got diagnosed with ADHD recently, and they refused to give her any meds, which I don't think meds are... Okay, needed. No. A controversial opinion.
Tell me.
I'm like, you know, I feel like maybe it's just different for me. Like, since I've started taking Adderall, it makes me way more work focused, but I also feel like not meaner, but I want to get work done because like I said, I've taken it and it feels like even though it doesn't drain my like loudness, character, I feel more serious when I have it. And I'm just like, I don't know, man. I'm like, let nature take its course.
So I'm confused by that. Are you saying that? So I'm hearing that it helps you, but
Yeah, but so where I am right now, if I was to go back to Ireland, I won't have Adderall. And right now I rely on Adderall a lot. And maybe that's my own mental issue with it. But like, that's why I split it in half. Because I'm like, don't want to run out of it. Don't want to do that. Well, if I'm splitting it in half and not even taking my right dosage.
Yeah. So that
Like,
I would not recommend, but it's something that I've dealt with. Can I, are we done with the lecture? You want to talk about this for a second or you want me to keep drawing?
oh, yeah, we can talk about that.
Okay. Give me just 1 second. Okay. Let me just stop sharing this, move you back over here. Let's talk about this. This is very important to talk about. So, okay. So can I share with you what my experience is of patients who take half the medication they're supposed to?
Yeah.
So generally speaking, I don't think it's a good idea, and here's why. So I've had lots of patients who, like you, have ADHD and are terrified of becoming dependent on ADHD medication. Also terrified of doing things like running out, because if I run out, then I'll be non-functional. So it's almost like you're saving for a rainy day or like preparing for winter, right? Where we got to make sure we have lots of potatoes in the basement in case we run out of potatoes.
Potatoes? Is that an attack on the famine, Doc? Just because I'm Irish? You could have said Brussels sprouts, but you chose potatoes.
Well, I don't think Brussels sprouts can be stored for a long time, right?
You got me there. You got me there.
So carrots, potatoes, root vegetables, turnips. I could have said turnips and been more culturally sensitive.
Yeah.
But maybe I did think potatoes. I don't know. And maybe it's just because I grow potatoes. So I was thinking about building a root cellar.
You grow potatoes?
Oh, yeah. They're very easy to grow.
Wait, really? Is it like just potatoes or you have like a little vegetable garden?
Well, the only things that are left now are potatoes. But I used to have okra, peas. I tried growing melons. They didn't really grow very well. The thing
Is
about
that like a comfort thing, or you just wanted your garden to look nice, or it was like therapeutic? Because I've heard plants are therapeutic.
So there's all kinds of reasons, but the short answer is I like gardening and I wanted to eat some of the food. So peas is a good example of it's very hard to get fresh peas. And I've grown tomatoes and stuff and lettuce. And so like lettuce and stuff is fantastic because the thing about lettuce is like you buy some lettuce, right? But then first of all, it's getting really expensive. And secondly, like for the first day you have fresh lettuce, but then if you want to eat it like a week later, it's going to be like not very good. So what I really like about lettuce is you can just cut off as many leaves as you want to eat on a particular day and the lettuce will just keep growing. Yeah. So
what? You don't have to harvest the whole.
No, you just snip whatever leaves you want. It just keeps growing.
How long does it take to grow lettuce?
Probably like 6 weeks for it to be harvestable in some way, and then it just hangs out for like 3 months, and you have fresh lettuce whenever you want it. It's great. Highly recommend it.
This is actually a life hack. It's actually a life hack. The amount of lettuce that goes stale in my fridge because I'm like, okay, peeling it off the sphere of lettuce.
Yeah.
I know that's not the name.
No, sphere of lettuce sounds great. So the other thing about potatoes is you just stick them in the ground and they just grow. They just like keep growing. You just like reach into the ground and you just pull out a potato And
I
then
know
there's just a
nothing
bunch of,
about gardening, okay? I'm actually shocked right now.
oh yeah,
I
it's, I
just
mean,
thought, like, you see an oak tree, it takes 70 years to grow. I'm just surprised that lettuce takes a month
yeah,
and 2
some of
weeks.
that stuff takes weeks.
Oh,
Yeah.
I need to get some lettuce.
Yeah, I highly recommend it. The one thing is my lettuce started getting bitter. Like, I don't know if you've had like bitter lettuce, and I could never figure out why it was bitter. And I couldn't make it kind of sweet. So,
I've never had bitter lettuce. That sounds like a big you issue. Are you sure you're not like eating some weird bitter? You've had bitter lettuce?
yeah, kind of bitter. Has like a bitter taste to it. Maybe it is a problem. Now you're frightening me.
Was
I never
it
really thought
brown?
about it. No, it was like fresh, but it was just had this bitter taste to it.
Okay. And you just ate it. You just kept
I
eating it.
did, which now I'm beginning to realize may have been a mistake.
You were like, well, I told myself it might taste bitter. Man could be eating a fucking lettuce that tastes like piss, and he'd be like, well, I grew it myself. Bon appetit.
Fair enough. Yeah, maybe I should have paused a little bit there. I
Did
mean,
you
I've
cook
had
it? Like, did you put it in
cook
boiling water?
lettuce.
Yeah.
No, I ate it raw. I mean, that's
Really?
yeah. Do you cook your
Aren't you
lettuce?
supposed to? Yeah, I thought you were supposed to boil it to get the insects off.
No, you can wash it, but do you boil lettuce? Do you cook your lettuce? Usually you eat it in salad. No.
Boiled lettuce? No, I just buy it from the store. I just assume because there's dirt on it.
Yeah, it could have been a problem. Now that I think about it. Anyway, I don't have lettuce anymore. Like I said, all I've got left is potatoes and sweet potatoes. The problem with the sweet potatoes is that they are very big but don't taste very sweet.
Feel like maybe your garden isn't really like your sweet potatoes don't taste sweet. Your lettuce tastes bitter. That's two big issues there. Well, look, you're
Fair
proud
enough.
of it. You're proud of it. So good
The
on you for growing it, but don't eat stuff that doesn't taste like.
the on the upside, my peas are excellent, like amazing, like better than most of what I've tasted
Well,
in
you
my
don't
entire
have
life.
your peas anymore.
Yeah, I mean, because they're a winter crop, so they're gone now.
Oh,
They grow in the winter.
frick. Well,
Yeah.
then how do I get peas right now? Answer that. Answer me that. Riddle
Well,
me that.
there may be some kind of hydroponic sort of stuff where you can grow it in certain kinds of controlled environments. That's also why peas are frozen, right? So if you like wanted to buy peas right now and you went to the grocery store, you would not find fresh peas. You don't see fresh peas at the grocery store. You just see frozen peas. So they freeze them.
Okay, I'm so stupid. I didn't even realize this. Oh my God. I'll never be a farmer. Man, my ancestors are crying and rolling over in their bed.
Well,
I didn't know any of this.
it's interesting that you mentioned that because there's actually an interesting theory that not really that scientifically valid. I can go into the data if you really want to, that people with ADHD were like not farmers. So there are some societies that were more hunter gatherers, and those societies actually have a higher genetic predisposition for ADHD. So even if you're thinking about a hunter, like if you think about a farmer, they wake up at the same time, they do the same damn thing every time, all day. Wake up at 5 a.m., they water this, they do this, they do this, they do this, they go to bed at the same time, right? Same routine. They never get bored. They're happy.
Yeah.
Some people are. And then you have hunters who are like out in the wilderness. They're like thinking about this thing. They're listening to this sound over here. They're looking at this footprint over here. They're smelling this thing. Oh, there's a little bit of like fur over here. And so they're like integrating a lot of stimuli, and they don't need to be focused on one thing at the same time. And in fact, the most successful hunters were the ones whose attention could bounce all over the place. And so there's some evidence that societies that have more hunter-gatherer, a greater amount of hunter-gathering as opposed to farming, have a higher genetic amount of predisposition towards ADHD because it was actually more adaptive. The problem is that there's larger studies where we look at that more closely, and it turns out that doesn't seem to be quite as simple as that, or may not even be true. But it's an interesting hypothesis that ADHD is essentially an outgrowth of like variable attention in hunter-gatherer societies.
That's actually so interesting. Holy
And-
God, it's actually so impressive how you can bring it back around. Like, I know I got sidetracked with the vegetable thing, but like, so I'm a hunter.
Oh yeah, that's why you're so successful as a streamer. right? So like, so this is the
So
other
much
thing.
cooler than a farmer.
I am beginning to think also that ADHD may be an adaptive advantage for content creation.
I actually agree with that. That's why I said I'm like, why take ADHD medication when you can let it out and be funny and like be all over the place and keep going. I feel like that's something that I always say. I think my BPD and my ADHD has helped me grow because I'm sure you know what BPD. I feel like I can half the time I don't know who I am. Like I disassociate a lot because I see a person and I mimic them to fit in. So with streamers, I feel like I can, mimic, not mimic, but like see how they act and then act like them and fit in perfectly. And I feel like that's what really helped me grow and like have kind of a foot in this industry.
Yeah. So it sounds like you can be what people need you to be.
Yeah. Yeah, well, I feel like that's normal though. Like I feel like even for like every friend group, you're a different person.
Well, so this is the interesting thing. So I think people with BPD may be particularly good at that, right? So everyone is going to adapt some, but then sometimes you'll have people who like stick out like a sore thumb, like they're just not able to adapt. The other really interesting thing about ADHD is there's studies that show that, so this is wild, okay? So people were looking at how often people have ADHD and depression. So if you have depression as a kid, just toss out a number, Minx. What percentage of people who you think have depression as a kid grow up to be diagnosed with ADHD? I'm setting you up
40.
to, it's 2.7%, 3%. Okay, now hold on a second. What percentage of kids with ADHD grow up to have depression?
2%.
50 to 70%. I debated you there.
That's what makes sense.
Huh?
How does that make sense?
It's
Wait, what?
fascinating. So if you're a child with ADHD, the likelihood that you'll be depressed as an adult is between 50 and 70%. So people were trying to figure out if a kid has ADHD and depression, or do they just happen together, or does one cause the other? But kids with depression don't grow up to have ADHD, but kids with ADHD grow up to have depression. And this is really fascinating. A big part of this is discordant relationships. So when you're a kid with ADHD at the age of 7, and everyone's in recess is standing in line to get on the slide, and when you have ADHD and you can't stand in a line, so you wander away and then you come back and you cut, right? Because you were in line, you were ahead of this kid, and then you wandered away for a minute, and now that kid is like second from the front, and you step back in front of him and you're like, this is my place in line. And then you cause conflict. So kids don't like kids with ADHD. They feel very lonely. They're isolated. They can't attend to conversations. They can't pay attention. So you know what kids end up doing? They end up becoming funny. They end up being the class clown. Because I don't have to know what's going on, but if my mind is fast and I can make some fart joke, or if I can fart in front of the teacher, everyone will laugh. And so kids are actually, with ADHD, are very isolated growing up. They have a lot of social problems. And that's part of the reason they probably get depressed is adults, because it's difficult. But what they do end up doing is being funny, just like you, Minx. Right? Because you're very good at being funny.
So there's always a win, huh? We're always looking at the win side. Might grow up alone, might, years of turmoil with no friends. Well, look at me now. Slightly funny. And a woman. Sorry, that was a low blow. I think women are funny. It's just I've seen comedians say that. I'm a woman. I can now I'm bottling it, so we're gonna change. Back to ADHD, Doc.
What?
How about that?
You just okay, sure. I didn't catch that. I didn't quite follow, but yeah, back to ADHD. So going back to diagnosis. So remember there's personality diagnosis, which takes a long time because we have to see fluctuations. And then there are things like ADHD. So there are some diagnoses which you can do faster because they're essentially malfunctions. So you can sort of like look at someone who's like bipolar or has major depressive disorder, and you can see like, okay, this is not how the brain is supposed to be working. Whereas the interesting thing about a personality disorder is that even though it causes them problems, it's the way that their brain grew up, like learning how to survive. So for example, people with BPD will have, one of the features of it is a fear of abandonment. And the reason for that is because oftentimes people with BPD like got abandoned in some way growing up. So their brain is like, this is bad. Let's make sure this never happens again. We want to watch out for this, and we need to be terrified of this. And so their brain forms with a fear of abandonment, right? It's not a bug. It becomes a feature. So we need to protect ourselves from being abandoned because it hurt so damn much the last time. We don't want it to ever happen again.
So then because you've obviously your shit. Is there any way a BPD brain can stop? Because the most annoying thing is I am self-aware when it's happening, and I'm trying to tell myself, stop thinking this, calm down.
So
I can't.
Let me ask you a question, Minx. Do you think that personalities can change over the course of someone's life?
Yes.
Then the answer to your question is yes. I completely agree with you. Right? So the way that we perceive and behave can change. And so the good news is that there is data that shows that BPD can essentially be cured. Like cure is like, it's a weird word, but essentially you can have sustained remission after a certain amount of like time and treatment or even stable relationships. So people have done studies that show that 50%, we don't 100% know about this, but being in a stable relationship for 2 years can potentially not quite cure, but essentially make it so that people no longer have, 50% of people no longer have BPD if they're in a stable relationship for 2 years. Now, does that mean that you have to be in a relationship? Is that the only cure for BPD? No. So you can be in treatment and learn things like there are evidence-based treatments like dialectical behavioral therapy. What are you looking for?
My phone. I'm about to download Bumble. If I knew that was the cure, you girl would have got Tinder and Bumble.
So that's where I gotta. It's not just the cure. So this is epidemiologic data. So people have done studies and taken people that have BPD and then no longer seem to have BPD. And what's changed? They were in a stable relationship for 2 years. But what we do know that you can do. So this is a little bit tricky. Whereas I wouldn't say that finding a relationship is necessarily the cure to BPD. But what you can do is do treatment like dialectical behavioral therapy. So that's like, it's a kind of therapy that's heavily influenced by mindfulness, is fascinating. So there was a psychologist named Marsha Linehan who herself had BPD. And what she was trying to figure out is like what worked for me, became a psychologist, was also very high functioning, very successful, and developed the best treatment for BPD on the planet, which is dialectical behavioral therapy. So that's what I would recommend if you want to get better.
Sorry, I need to
Dialectical behavioral therapy. And I can even explain to you kind of what it is and how it works.
Yeah, because I like, at the time they sent me to a lot of therapy, but it was like the exact therapy I was going for my depression, where it felt like it didn't do a thing. I didn't know there were like different types. Yeah, if you could explain it instead of me reading it off Google, that'd be handy. Thank you.
So I'm going to ask you a couple of like somewhat personal questions. You don't have to offer a whole lot of detail. It's going to be like more yes or no. If you want to add color or explain what your experience is, you can, but you don't have to. Okay. Mm-hmm. So sometimes people with BPD, their way of thinking about something becomes very black and white and very rapidly, and oftentimes completely black. So is that something that you feel comfortable? Like, can you just give us an example? Like, it doesn't even have to be real, but like, has that happened to you where?
Dude, consistently, like it'll be something small, like I'll be driving in the car, I'll get a message that just upsets me, and I'm like, everything I'm doing today sucks because this is in my head for the and I'm like, what's the point in being happy when this one thing has upset me? Or like even when people are just late to something, I'm like, well, now we can't plan efficiently and like it's ruined, and it's like everything's just, and I can't see the bright side.
Okay, perfect, right? Can't see the bright side. Okay, so it's ruined. So when one bad thing happens, it's ruined, period.
Yeah.
Right? You can't see the bright side. I couldn't have said it better myself. So what Marsha Linehan did is she studied Buddhism. And she discovered a very interesting principle that is rooted in something called Advaita Vedanta, which is non-dualism. Okay, I know it sounds kind of weird. Oh, we'll catch you up. Give me a second. So essentially what she discovered is something that she translated into English is the dialectic, which is that two things that are polar opposites can be true at the same time. And once someone with BPD understands that and can live that, they get a lot better. So I'll give you an example. I can be mad at you and still love you. But someone with BPD can't hold both of those thoughts. That's why it's so terrifying. Either you love me or you're mad at me. And I can't have you ever being mad at me because that means you don't love me. So it's ruined means you're late, therefore it's ruined. It's impossible for you're late and we can still have a good time. Sure, we're half an hour late, but we can make the most of the next 3 hours. That thought is very hard for people with BPD.
I know, and it's pissing me off now because I'm literally thinking like someone didn't reply to my text for 2 days because they were busy, and I'm like, I'm done with this person.
Yes.
I'm like, they can't even send me a message. Like, I am completely done. They're cut off, and then they message me like, I'm so sorry, and I'm like, oh, you're fine. And it's like, why can I change from planning to cut them out forever to being like, you're my best friend, I love you.
Yeah.
And not balance it.
Yeah. So here's the thing. Here's the tricky thing about what DBT teaches people. It's not balancing it. It's not that one goes down and one comes up. It's that both are true at the same time in their intensity. So over time, it will lead to balance. But it's kind of this idea that, like, I don't know how else to say it. It's just replacing in your mind. So when your mind reacts to something, it's never and, it's always but.
Yes.
Right?
It is.
It's either or. It can never be like two things. Like, this person is mad at me and they love me. Like, you can't say that.
What's annoying. I'm aware of that, and I'm saying to you I'm aware of it. So why at the time, every time, because I've had BBD for years, why can't I stop and realize that at the time? Why does it take the next day to be like, oh, actually cutting this person out of my life and blocking them is not the solution? It's so aggravating. Because I know I'm talking about my issue, but it keeps happening.
Good, excellent question. So let me ask you a couple questions, okay? So what's different? You said, why can't I realize it until the next day? Right? You said that. You asked that question. So let me ask you, what's different between the day it happens and the next day?
My emotions are strong because I'm overthinking and they did something.
Excellent, right? So 100% correct. So this is where, remember how you were saying that your stress levels, I drew the stress graph and you're like, no, Dr. K, that's wrong. It's way higher and way lower. So people have done studies. This is really fascinating. When you have someone who has BPD, their brain's ability to experience negative emotion is way faster than a neurotypical brain. So your ability to, like, for me to go to 0 to 100 in terms of being pissed will take me like 60 seconds. For someone with BPD, it'll take like 4. I'm just making those numbers up. I don't know what the exact numbers are. But the ability for someone's brain with BPD to experience negative emotion is more rapid. The other really thing that just causes people to suffer a lot is the ability for the brain to calm down takes longer. So not only is it easier for you to feel negative emotion if you have BPD, but it takes you longer to kind of like reconstitute. So it'll take 24 hours instead of like 2 hours.
That's so annoying because that means like my brain is actually slower than others. It's like, why? Because I know like I should be able to, because right now I'm thinking about stuff that I got mad about where I'm like, why did I get mad about that? Or like even times like I'm gonna out myself here. My older sister upset me recently because she said something to my mom. And I attacked my mom over it because I'm like, why didn't you tell me this? You're fake. And then the next day I was like, I love you. I'm sorry. I don't know why I did that. And it's like, why do I even go for the kill when that person hasn't upset me?
Yeah. So that's where, so if we talk about the treatment of dialectical behavioral therapy, that's why mindfulness is such a big part of it. So mindfulness is going to be one of the central techniques that can literally like train your brain, like everyone's brain, to be like emotionally a little bit more detached, emotionally kind of calm down. You look like you're getting emotional a little bit now. Is it happening?
Just slightly. 'Cause
Are
it's,
you frustrated? Are you frustrated with yourself?
it's annoying because I'm talking about it here, but why can't my brain understand it when it's
Oh,
happening?
okay. Hold on a second. So, Minx, are you being black and white in the way that you judge yourself in this moment?
Maybe.
Say more. What are you thinking about yourself?
Because I can see all like a lot of relationships I've ruined with it, and talking about it is just like different and easier to understand. But then at the time, it's like, how is my brain so fucking dumb and slow that I can't process and realize how normal the situation is instead of blowing up and ruining everything?
Yeah, so that in and of itself so makes it's going to sound kind of weird, but I want you to take a step back from that conclusion because that conclusion is black and white that you're fucking dumb and slow. Because you're neither dumb nor are you slow. What you have to understand about this is what I've come to understand about BPD is the reason your brain is like that is because it's like that to protect you. Because there was probably a time in your life that if it did not think like that, you would have been screwed. So BPD is like your guard dog. And now what's happened is that, you know, people have been trying to break into your house for so long that any stranger that comes over, it starts barking. So you're not busted. You're not broken. You're an amazing person. This is just what happens. This is your karma. It's your karma that you grew up in a particular circumstance where you have these particular ways that you're wired that, let's remember, makes you more successful at streaming, has allowed you to come to LA, has allowed you to fit in to the streamer culture, and causes you to suffer. Right? That both of these things can be true. That this can, I wouldn't quite call it a gift, but let's call it a gift. That it can, some things it can do good for you and some things it can't. Now I'm having trouble reading what's going on in your brain. Are you
No,
discarding
that's
everything that I'm saying?
no, I'm listening, and it does make me like it. I do like agree with the thing. Like that's why I say I try to call it a gift, because like half of my viral clips that happen is when I feel like a trigger go in my brain, and I'm like, instead of ending and being upset, act into that emotion and make it a character. And it's like, but it's also like turmoil when you're alone, and it's like, then
100%.
it feels like I'm fucking mimicking my own issue, and
100%.
like, you disassociate and you can't tell what's real and what's fake.
Yeah. So I think this is the real challenge of people that I've worked with who have BPD is that it is so responsible for their success and causes them to suffer immensely. Right? Like, sure, you're successful, but boy, have you paid a price for it.
Exactly like you said, with all the like darkness. Like I call my mom all the time, like every day, and I tell her like how sad I am, and then she'll be like, "But look how much like you've done and how much you've grown. You're in LA, you're doing dreams," and that just makes the thing, because it's either black or white, and it's just so annoying because this is the first time I can properly talk about it, and it's like I can put it to advantage, but it sucks so fucking bad when you're
100%.
alone. And then
Yeah.
I don't want to be with people, because if it acts up, I just hurt them.
Yeah. That sounds like an impossible situation that you can't win.
Ugh.
Because on the one hand, you don't want to be alone, but on the other hand, you don't want to ruin your relationships if it gets out of control. You feel like you're not in control. So almost to protect them, you have to be alone, and then you're signing yourself up for being alone and suffering.
Exactly. Like even small things. Like if I like have a plan and I'm like, because I sleep early, especially with my boxing, like I had a plan for a friend to come over and they were like an hour and a half late, and I ruined the whole night because I'm like, we wasted that hour and a half and now I have to sleep in an hour when we could have 2.5 hours, and they didn't get why I was upset, and I'm like, why can't I just tell you the reason instead of being mad and sulky and it's annoying because I can talk about it now, but I can't talk about it at the time.
So this is so I would, you know, if this is what I feel confident about Minx, is that DBT, generally speaking, helps people a lot who struggle with the things that you struggle with. And what it literally will do is like, so this is why the mindfulness component is such a big piece of it. So there's a lot going on here. So would it help you for me to talk through what I think it could help you with?
Yeah.
Can I think for a second and compose my thoughts?
Yeah, no, absolutely.
I may have to whip out the
Take
iPad again, okay?
You know what? Actually, when I cry, it brings color to my face, and I'm kind of feeling cute right now. Usually, I'm like a walking corpse. We got a little blush going on, natural blush too. Ooh.
There's the humor, there's the ADHD, there's the leaning into it, there's the entertainer, right? Look at you looking at the dialectic now. Bring some color in. Hey,
Yeah,
it's not
here
all
comes the
bad,
color. Yeah,
right?
I'm like, it's making my cheekbones pop too, and I'm starting to feel like a little model.
Look at you rocking it. Um, sorry, you just threw me off, which I'm not upset about. I really appreciate. But I was just thinking a little bit about. Okay. Let me just think for a second, okay?
Yes, take your time. I'll sing a little song with chat. Come by, my Lord. Come by, come by, my Lord. Come by. I'm not singing Christian tunes. I don't know why I'm reverting
Okay.
to that. I
Give
ain't
me.
even Christian anymore. I'm agnostic.
So let's think through. So let me just understand this, okay? So it seems like you're very frustrated with yourself for
Yes.
losing control.
Yes.
You're also not frustrated, but I get the sense of almost like you feel kind of powerless, that it's like either or. Like
Yeah.
either you're on and you're streaming and successful and fun and happy, and or you're alone, which we haven't really talked too much about. I don't know that we really need to, but and then in the loneliness, there's suffering, there's, you know, kinds of stuff. Then there's also, okay, so let's like think through this from a very basic level. So the first thing to understand is that if we're talking about treatment, so here's the way that I would think about treatment for someone like you. This is basically how I think about everyone with BPD. So the first is learning particular skills that literally like work on your brain and correct that emotional, when I say sensitivity, I don't mean like, oh, you're sensitive. Like, I mean like literally like your neurons are like twitchy, and their ability to feel anger or upset or things like that is like very, very quick.
Yeah.
Okay. So you can learn certain grounding techniques. I'm going to teach you one today. Okay.
Ooh,
That
exciting.
will hopefully, if you practice it, because it takes practice, it'll help you. If we think about today versus tomorrow, what's different? It's that your emotions have calmed down. It'll help you calm your emotions. And then if you calm your emotions, it'll be easier to realize. So this meditation technique won't help you realize. It won't make you realize anything. All it'll hopefully do is counteract that rapidity which your brain gets upset with, and also the length at which your brain stays upset. Okay?
Yeah.
So we got to help you in the moment.
Okay.
Second thing, so we're going to start with like meditation at the top. Second thing, there are going to be things that you are frustrated with yourself. You're going to be frustrated with yourself because you have BPD. They're the things that you blame. Why can't I ... That makes you lose confidence in yourself, right? Because you think you're busted on the inside. If you lose confidence with yourself, you become more vulnerable to the opinions of others. And then the love and affection of other people becomes more important to you because you don't believe it in here. That combined with the brain's itchiness creates like a bad scenario. You see that? Like if I can't love myself, I need other people to love me. If they don't answer my text message, because they're going to be the ones, they're the ones that love me. Then like it triggers the whole thing. So the other thing that you need to do is like forgive yourself for being who you are, because this is all a part of your journey, Minx. I believe that 100%. Even if you think about, if you never had BPD, we wouldn't be talking about this. We wouldn't be streaming online right now. 1,000 people, 10,000 people, 20,000 people, 50,000 people would not watch this. And there are thousands of people just like you out there who may not even realize what they've got. Sure, it took you 9 months to get diagnosed. You got diagnosis. Think about all the people out there that have no idea. They're just, they understand this. They live it every single day, but they have no fucking clue. And so there is a karma to the work that we're doing here. There's like an important...
That's actually something I always remind myself, like, because I know BPD is hard to diagnose and it can be misdiagnosed so many times, where I'm grateful that I know what the root of the issue is and that there is ways to work on it. Like you said, the therapy, which I'm definitely going to look into that.
Yeah. So the second thing is you got to learn how to forgive yourself for having BPD in the first place. Next thing to do is understand the origins of it. So understand, because remember, this is your brain's way of protecting you. It's the way that your brain, like, it's not busted. That's what's so tricky about a personality disorder versus like something like depression. If there's a neurochemical imbalance, we can give you a pill to correct that neurochemical imbalance. It's actually a malfunction of the brain. Whereas narcissistic personality disorder, borderline personality disorder, these are not malfunctions of the brain. They're adaptations of the brain that now start to cause you problems. So you have to understand where that came from. You have to understand why your brain evolved to be this way. And the truth is, it's not your fault. You're not like fundamentally busted. It learned somewhere along the way that we need these techniques. It's like, I don't know, what games you play or if you play games, but I almost think about personality disorders as like blood magic. You know what blood magic is? Have you played any games with blood magic?
I've not played games with blood magic, actually.
So like this is this idea where you've got like mana, right? And you use mana to cast spells, but then there's blood magic where you use your life essence to cast spells. And so every step forward comes at a cost to you. And I almost think about personality disorders as like the blood magic of psychiatry.
I'm a fucking wizard is what you're saying.
You are a wizard, right?
That's so
but you
cool.
pay the price for it. Each
Yeah, I
time
do.
you cast a spell, each time you work your magic, it comes with a fucking price.
But now that makes BPD so much cooler. Now I'm like, well, yeah, when Lucy,
Yeah, I mean-
that, you put it into that little perspective, and I'm like, I'm pretty cool with my BPD. You're right.
Yeah, I mean,
can
so
give that
like I think that's the thing about blood magic is it sounds cool when you play it in a video game. Sucks to actually be the wizard who's like losing a piece of their life force. Right?
That's true.
But
That's
I think
true.
it is useful to understand the origins of why you are the way that you are. And then ultimately, I think it comes back to meditation. So once you do all that stuff, and you also develop like coping skills and things like that, once you come back to it, I think that there's almost like a spirituality to it that at the end of the day, when I work with people who are like really, I can't say the word cured because who knows how they're doing now, but people who get so much better to where they no longer, if they went to a psychiatrist and they put them through the diagnostic process of BPD, they would not qualify. That's what we can say confidently. Is that there is like almost like a spirituality to it. And this is what I think Marsha Linehan kind of stumbled upon, is that the world is fundamentally not black or white. Like if you think about, you said that, the potatoes or my lettuce is bitter, or, the sweet potato
Now,
isn't sweet.
why are you coming back to potatoes, Doc? I said nothing about your potatoes.
No,
I
I'm just
talk shit about your lettuce.
No,
huh?
I'm not.
Being
I'm not.
very stereotypical
No,
over here, aren't we, Mister
No.
Doc?
Let me finish, please, Minx. So, like, at the end of the day, not all sweet potatoes are going to be sweet, right? Some of them are going to be sweeter than others, and that's just life. That at the end of the day, like even beyond DBT and dialectics and being able to hold two opposites to be true, that's just what life is. That life is ups and life is downs. And even then, if you really go far into spirituality, you can start to do things like develop a detachment where you can acknowledge that, did I want this thing? Yes. Did I want my friend to show up on time? And could we have had 2.5 hours of fun? Yes. But they showed up an hour late. And so the most I can get is an hour and a half of fun. And now I sort of have not really the choice because we can't really control it. We make it sound like a choice. It's really not. You know, with practice and with dedication and with effort, I can still enjoy the next 90 minutes. And this is something that I've seen a lot with, like, you know, people like, I know it sounds kind of weird, but some of the most inspiring moments in medicine for me have been people who have been diagnosed with cancer. So it's like they have a limited time on this earth left. And like, you know, some of them really learn to make the most of it. And like the last year or 2 years of their life, like, is there suffering and awfulness? Absolutely. But there's also like beauty, and that, like, that's what life is. And they serve as an inspiration to people around them. And then I also hear really bizarre things, which I still have trouble accepting, which is like, cancer is the best thing that ever happened to me. People will actually say that, right? Usually these are people that are in remission. Because, you know, but that like cancer helped them realize what life is and like stuff like that. I mean, people will say things like that. It sounds crazy.
It is, but it does make sense. And going back to, you said something there where it was like the last 90 minutes is what matters, and it's like that's another thing that affects because you said, you know, a new days, new emotions, and that's true. I restart, but then, you know, the guilt that comes with it, because I'm like, I'll think exactly what you said there, that 90 minutes. I have that in my head the next day. I'm like, why did you have to be like that and be so moody when you could have enjoyed the time that you had with them? And then I feel worse the next day because I just have a guilt building up in me, and it's like, damn, you were so angry then when you didn't even have to be angry, just neutral. You didn't have to.
So Migs, that's the tricky thing. So that is the same thing though, because that's the black and white, because the next day, instead of enjoying today, you're ruining today by thinking about yesterday. And so the cycle perpetuates. So that's where you really have to learn how to forgive yourself. Because if you can learn how to forgive yourself, you can also learn how to forgive your friend for the 60 minutes they're late and enjoy the 90 minutes. It actually starts with the next day, not the 90 minutes. It starts with, hey, this is the way that I am, whether you believe in God or karma or entropy or chance or whatever. This is the way that the universe has made me. Right? This is the fruit that has been born from the tree of my life. And this is what it is. It may not be the sweetest fruit, but that's okay. Right? So it starts by like forgiving yourself, like really. And like the four components are like learning how to manage your emotions in the moment, learning how to forgive yourself for not managing the emotions in the moment, learning the origins of why your brain developed to be this way, and ultimately like almost take a spiritual perspective and recognize that this is all what's supposed to happen. And that despite all of the suffering that you have, you can grow from it, you can learn from it, you can appreciate life so much more through these experiences. You can help the world and make them a better place. And your community absolutely loves you. And that's where, like, because, like, sure, you're here with blood magic and you're suffering, but you've enriched so many people around you. So you suffer and you make the world a better place. You have fun and you suffer. And you are, I'm sure, frustrating to deal with by some of your friends at times, and an absolute joy to have in their lives.
God. I fucking hope so. I get these bitches food all the time. I better be a fucking joy in their life.
Yeah. And that's where you may be getting them food, but bribery only works so far. And at some point, they stick around just because.
You get that to Boa? Bribery always works, okay?
What?
Not get you very far. Bribery will always work, okay? Bitches love some bribery. Some bribery on a Wednesday evening. Is it Wednesday?
Yeah.
There we go. Knowing the dates. Look at me.
How you holding up, Minx?
Good. Really good, actually. This was not how I expected to go. I was expecting more to be like, hey, funny the whole time, but it's actually been really helpful.
Yeah. I'm noticing that maybe if we pause for a second, you're feeling conflicting things now.
I'm
Or maybe
feeling
not.
that you might be correct, actually.
Right? So that's good, right? So this is where like this is just what you have to learn. And the cool thing is like right now you're feeling those emotions. I actually see you doing it right now. I see you feeling the emotions and feeling them intensely, but also not losing control of them. And it's what you're doing right now is hard. It's to be commended,
Thank you.
right?
Thank you. Could we
'Cause
get a 4-7 in chat, please, if we commending it? I'd like a... Wait, that's not the emote, but they know
I
what I'm
don't know.
talking
I just
about.
did what you did. I didn't know what you were doing.
Oh 07, I mean. Oh 07. There they go.
What does that mean?
They're commending me for my bravery on dealing with my emotions. Do you not have a... are you just seeing oh 07, or are you not seeing the emote?
Yeah, I'm just seeing oh 07.
Okay,
Uh,
so it's a salute. They're doing a salute.
Okay. Well, I salute you, I suppose. I
Thank
just feel
you.
weird saluting
Thank
people
you.
because I don't know how to do it properly.
I
But
think you did it fantastically.
thank you. Okay. Beautiful sigh. You want to learn a little meditation technique?
Man, I've tried meditation so many times and I'm like, oh, now what?
Yeah.
Make me better already. I'll sit there cross-legged and I'm like, why am I not feeling better?
I'm with you. Yeah, those meditation techniques suck. Can I try to teach you something else?
Yes.
Okay. So, I felt confident in what I was going to teach you, but I wonder. Okay, no, we're just going to do this. All right, so I'm going to teach you. So I'm going to share with you a phrase in English. Okay.
Uh-huh.
So have you heard the phrase "This too shall pass"?
Yes, my mother says this to me every day I call her.
And does that upset you?
No, it's just comforting at this point. It used to upset me as a kid. I'm like, okay, stop. But now hearing it from a distance, I'm like, you're right. This too shall pass.
So I can't tell if that means that this is the right thing to teach you or the wrong thing to teach you. But let's stick with it for now, okay?
Huh?
So what I'm going to teach you is a really simple technique. So if you look at the sections of your fingers, okay? So like you see these like you've got 3 on each finger.
Uh-huh.
So I want you to start with this one, the middle one of your ring finger. Okay, and then what I want you to do is we're going to go up to the tip, out to the side, to the pinky, down to the middle. Good. And then down to the bottom. Good. And then across this way. Good. And then across this way. And then across this way. And we're going to go up. We're going to go up. We're going to go across, down, and then back to where we started. Middle of the ring finger. So you see we're making a loop. So we're kind of going like that, and we're making like kind of a loop. You see that?
Oh, yes.
So there's 12. There are 12 of these. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then back to the center. So what I want you to do the next time you're feeling upset, and we're going to practice now, the next time you can't let something go, okay? What I want you to do is do 12 rounds, close your eyes, take a deep breath, and do 12 rounds of "This too shall pass." And do 1 breath with each one. And what I really want you to focus on is the sensation across your fingers of just touching, and then like, so does that sort of make sense? We're going to do like, you're going to take a deep breath in, you're going to say "This too shall pass," and then you're going to move on to the next one.
No, I actually like this way. I never even thought. Damn, I actually like this way because I feel like when I get anxious, I like will scratch my palm a lot or something. But
Yep.
this is more like a chill way, and it also makes me feel like I'm in Tokyo Ghoul.
So
Necky.
let's do it together, okay? So
Okay.
did you get the sequence? I know it's kind of confusing. So we're going to start here.
Middle.
Yep.
Oh, okay.
Yep, and then show me what's next. So yeah, so we go down and then out.
Oh, down and out. I thought it was up and out. Okay, down.
Down, right? Then out to the pinky, and then up the pinky. Good. And then this way. And then this way. Right? And then this way. And then down. 2. Good. And then 3. And then back to the center.
Okay.
Good. Yeah, but don't skip the pinky, the middle pinky. I skipped it. That was confusing because
Okay.
I'm kind of ADHD too.
Okay.
So there should be, so just touch each of them 12 times. I mean, sorry, they touch each of them once, and that'll be 12 rounds. Good, very good. So then the middle, good. Down, back towards the middle finger, good. And then crossover, perfect.
Ah.
Okay, so we're really going to focus on that tactile stimulation. So you can take, if you, this is the other thing, the more upset you are, you don't have to do one breath with each one. If you're upset, you can do it super fast. This too shall pass, 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 this too shall, this too shall fucking pass.
Okay.
And then slow it down. Okay. This too shall pass.
Wait, I like this. This is very comforting. Maybe it's because my mom always says it, so it reminds me of home, but it's also like fixing my nail digging thing. It's like a mix of both. I've never heard of this. Two shall pass. Two shall pass. This too 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 shall pass.
Good.
Ah.
Okay. Now, you can work your way up to doing it 9 times. So you can do this when you're upset, but ideally you want to do 9 rounds or 108 breaths or 108 this too shall pass. Okay?
Okay.
So you can even keep track if you want to get things super complicated. You may lose this because of ADHD, but you can even keep track on this hand. So as I do 12 over here, I move down here.
Oh, no, Shaw. I'm gonna count and be able to do that.
Okay, don't worry about it. So
Man,
you
you
can
know,
just,
I got small frontal lobe. I got epilepsy.
well,
That's true. Did you know that? People always think I'm joking when I say it. People with epilepsy have a smaller frontal lobe that like hinders their decisions.
yeah, people with ADHD have that too. So
Oh, great. So you're saying I have a double small brain, huh?
no, I think
Well,
that's probably
fuck me, I guess.
Mix. Do you mind if I ask how old you are?
I'm 25.
Okay. So your frontal lobe will continue to grow until you're 30 or 32. So things could get better for you, even just on their own.
Let's have our fingers crossed, because she better be growing, man. I'm missing a big part of my brain right now.
Do you have any questions about the meditation technique? Do you understand it?
No, I actually do understand that, and I like it. I thought you were gonna make me like crisscross my legs and like close my eyes and hum in silence for like 30 minutes.
No,
and I cannot
silence is
do that.
terrible. So when
This
when
is
you're
way better.
so here's the thing for you, Minx. You need activity and grounding for meditation. What you don't silence is just going to be filled with your negative thoughts. Like if you try to like sit and meditate when you're struggling, like you have so much energy in the mind, right? Like that's what makes you so damn successful is you've got like so much energy. And so what you need to do is direct that energy, because when you get upset with yourself, it's just bouncing around in your head and creating thought after thought after thought after thought, and it ramps up and ramps up and ramps up and ramps up. This too shall pass. Boom, 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 as fast as you can go, like a machine gun. And then slow down.
You know what? You said bouncing, and that's actually how I explain it. When I'm angry, you know the Windows logo when it hits the corners?
Oh yeah.
It feels like that's what it's like in my head, ticking. It's like boom. And every time it hits, it ticks me, like it makes me angrier and angrier and angrier over a small situation.
I don't know if I agree with small, right? Because the whole point is that it's not small to you.
It's black and white, and I just see it as
It's
dark,
small.
so it's big
But-
to me,
but
but could be as small to
So
others.
if you stop seeing it as small, because that's the black and white. You see that? Because if you view it as a small situation, that means that it's insignificant, and you're so stupid for getting caught up in it. That's the no. It's important. You were really looking forward to this, and your friend was an hour late, and it's okay to be upset by that, right?
You're a very smart person.
Huh?
Very understanding, huh? You're very understanding guy. Man, saying my thoughts before I can even think them out here.
Yeah, I mean, I think cut yourself a little slack. Thanks. Seriously, you deserve it.
Thanks. Thank you.
And now I've gone and messed it all up again.
This too shall pass. See, I'm not even mad now. This is just a
Good.
comforting cry. It's
Okay.
more like a comforting one.
Good. Well, any thoughts or I mean, I feel like this is a good place to stop for today in general. Like I think we've covered a lot and
Yeah.
I don't want to forget what we learned in the first half. Do you have any thoughts or questions?
I don't really have any questions. I just feel more like this was nice. It's because it's like you have therapy alone, private thing where it's nice to be able to talk about it and like in a safe environment. Chat, you'd be very sweet. Where I was just like not expecting to open up so much, but chat, you'd be very nice too. So
I thought we were going to do ADHD lecturing.
fucking man, this ADHD we skip from fucking lettuce to fucking graphs to
Yeah.
fucking
You can't blame me
CPD.
for this.
No,
This
it
is
was like
you.
all half the time. I like started asking about your lettuce, your bitter lettuce, by the way. And
Yeah.
also, there was a point where you spoke about like you did an analogy, and you were like, "Not all sweet potatoes are sweet," and you were really into it. But I wanted to roast you, and I'm like, "Man, that's just your fucking sweet potatoes." You literally like said earlier, sometimes they're not sweet. I'm like, I think this is an analogy like hitting close home. I've never had a sweet potato that was not sweet. Okay, that's just you and your strange ass garden. Okay.
Yeah, maybe with my bitter lettuce and unsweet sweet potatoes, I don't really know what I'm growing here.
Man's eating
Fair
the
enough.
opposite of salad.
Roast away. That only makes it sweeter. Okay, well, Minx, I wish you all the best. Good luck.
Thank you.
One very concrete recommendation, I would recommend you kind of look into DBT a little bit more. There are also groups which can be really, really good that they'll teach you like the skills and stuff.
Yeah.
So you can just like kind of look in your area if you're, and if you have any questions or anything like that, just DM me. Okay.
Perfect. Thank you for
All right.
having me on. I appreciate it.
Thank you very much. Take care.
Thanks for helping me. Bye.
Bye. Oh. Okay, so that was that. That changed rapidly, but we talked about a lot of important stuff. Yeah. It's interesting because I think mental health is like, we kind of think about it so in isolation, right? We think about ADHD or we think about BPD or we think about Adderall or not Adderall or like, medication or not medication. Whereas like the truth is like, it's so much more integrated than that. And the people who tend to do well, I think, are the ones that are really able to take an integrated, non-isolating approach, which is part of what I dislike about the way that this profession is going. So like one thing that we see a lot in the United States, which is not, I mean, it's good for a lot of reasons, but has like some serious cost to it, is the separation of medication from psychotherapy. So a lot of times people will have a psychiatrist who prescribes medications and someone else who does therapy, which sort of makes sense. I mean, there's a lot of good reasons that we do that because there's a shortage of prescribers, for example. So like, you can just treat more people as a society if you have someone kind of prescribing and someone else doing therapy. So there's like some like, public health, access to healthcare kind of issues there that sort of make sense for that. Also, sometimes the medication is pretty simple and it's not necessarily that integrated. But I think, one of the things that I've come to really appreciate is that taking care of your mental health and like being happy or healthy is not just medications. It's not just therapy. It's like the whole shebang, right? It's like learning skills to calm down your emotional mind. And I don't say that as an indictment. I mean, when your mind is ramped up, your brain is ramped up and it's triggered in a particular way, and your neurons are just, you get that kind of like thoughts bouncing around in your head. You need something to decompress that in the moment. But that's not enough, right? Then you also have to understand, okay, how did my brain get to here? How did my mind get to here? Why do I perceive the world in this way? And that's what I really like about some of these, this deeper sort of work, is you start to recognize where your patterns come from. And once you recognize where your patterns come from, then the cool thing is that forgiveness becomes so much easier. Because the whole thing is like, we just think that we're idiots and we're busted, right? Like, oh my God, like, why am I so stupid? No, it's like you became that way because it actually served a very important function for you. And then what we also have to do is think a little bit about the consequences of things like BPD and ADHD. So this is part of the reason why I think people with ADHD grow up to have depression, is because they like don't know how to properly mourn their like negative experiences. Right? Because when you're a kid, like this is what's so hard, is that being ADHD makes you fail at being normal. So you're smart and you know you're smart, but you can't do what other kids can do. And so like that consequence or that conclusion that like I just can't be normal, like there's something wrong with me, that seed is what really grows into depression. And so this is where there's not just the ADHD itself, right? There's not just like the attention problems and things like that. There's also like the consequences of having lived with it, which require another like layer of work. But the good news is that, you know, some people may think, oh my God, this is so overwhelming. Like, how am I supposed to do all this stuff? But the good news is that if you're kind of feeling like you're stuck in life and you haven't done any of these things and you feel like, okay, I'm operating at like 40% of my potential. The good news is that the more things that you haven't done, like you can get 20% from meditation, 20% from self-forgiveness, and 20% from like, you know, learning like organizational skills for ADHD. And you can get to 100%. That's the real thing that I've seen as a provider, like as a treater, as a psychiatrist, is that there's a, like people, you will be amazed at what people are capable of. You will be amazed at what you're capable of and like actually getting there. Because the truth of the matter is that most of us haven't done most of this stuff and there's a lot to be done. And you just got to get started and then it'll like happen. Like give it like 3 to 6 months for each of those things. And then a year to 18 months from now, you will be in a completely different place. Right? So someone's saying, true, but I think the percentage is smaller than 20. So that too, you have to be careful about your own cognitive bias. And we saw that with Minx towards the end. Where it's like, why do you think it's 20%? Because you're so damn hopeless and your mind perceives things in a negative way. So you may be surprised because there's a miscalculation, which gives you 20% to begin with. Like right off the bat, you're just off by 20%. So the amount that you have to go is like less. So you deal with cognitive bias, learn how to meditate, learn how to forgive, and learn how to deal with like depression or anxiety or ADHD or whatever. And then you're back to 100. What's the hand meditation thing called, by the way? I don't know that it has a name. I mean, I guess it's like a grounding, forgiving meditation with mantra kind of thing. I don't know. It's kind of like japa, yeah. It's kind of like a mudra, yeah. So this is where, so I want you all to understand this. Meditation techniques, like, they're like, there's a formula, right? For like what meditations do. So it's kind of like cooking, where it's like, what is this dish called? Well, you know, like there's some pasta in there and there's some vegetables in there. And there's like, this is what we call pasta primavera, but instead of just fresh vegetables, I put some sweet potatoes and potatoes in with the pasta. So it's like a high carb pasta primavera. You know, it's a combination of stuff. And so in my experience as a meditation teacher, like meditation should do 3 things. It should be personalized, it should be purposeful, and it should be precise. So like you should do these 3 things with meditation, right? It should be designed for you or focused on you. It should accomplish a particular goal and you should do it properly. Like it should be done with precision. So not like 9 or 11 or 14, you do it 12 times. You stick with the precision of the technique. With Kaya Sthiram, for example, you don't move. It's not move a little bit. It's you don't move. So if you're doing a satya practice, a truthfulness practice, it's not like I tell the truth most of the time. You tell the truth all the time, right? Okay, so someone's saying doing all this feels overwhelming. Yeah, it's okay for it to feel overwhelming. Right? Then the question becomes, do you let the feeling of being overwhelmed dictate your actions? You can still do it. even if you're feeling overwhelmed. Okay. So one thing that we wanted to talk a little bit about before we wrap up is actually, I think we may actually go for a little bit longer. I wanted to share with y'all one second. Okay, so a couple of things that we're going to talk about. No, I don't think so. Uncapped subathon? No. So okay. While I love the sentiment, don't get me wrong. Maybe we'll show up later and stream something else or game or something like that. Which, by the way, did y'all know that Elden Ring is a very long game? It is a very long game. So a couple of announcements. So May is Mental Health Awareness Month. And so we've got some awesome streams planned. We'll see y'all on Friday. I don't want to share what that is yet because I just want to make sure it's happening. So we've got 4 or 5 events going on in Discord that y'all can get on board with if you want to. So we've heard, and a lot of this comes from like what the community needs. So the first thing is that there's like a May You Sleep Well event going on. So this is to help people fix their sleep schedule, led by our fitness workshop lead, Tomination Time, who's also an awesome streamer. It'll run throughout May. So it's modeled a little bit on the dopamine detox event that we did in early 2022, which I think a lot of people enjoyed, benefited from. There's a Clean Your Room Together segment that we're doing as well. So like for those of you that feel like you can't get started with cleaning your room, or like, oh my God, I need to clean, just like use this behavioral anchor, use the accountability anchor, clean your room with us. There are bot-hosted lobbies for people to study. So this finals time may be rolling around, right? So if you guys need some structure and support in terms of studying. So we also have a student sub-community, and then we also have a career sub-community. So this is where, as Healthy Gamer has grown, we've realized that the needs of the community are shockingly not all the same. So this goes back to like our philosophy of teaching meditation, right? Things should be like more personalized. So if you're a student, we've got study together bot hosted lobbies. If you're past the educational phase and you're career oriented, you have a job, etc., we've got networking events and things like that. And then we've also got bot guided meditation. So if you guys want some kind of anchor to help you build a meditation practice, that's on the Discord too. So I think we're going to be focusing a little bit on ADHD and learning how to focus in terms of meditations. And so the other thing that we've got, so a couple of other things. So all donations and all profits from merch sales go to the Healthy Gamer Foundation, which is our nonprofit that is devoted to helping young people with their mental health. So that is going on in May. And then the last thing that I want to talk to you about, and I'll sort of share a little bit about this, is we have, so career coaching is now live. So some time ago, we started a coaching program. And so people signed up for coaching. And what we've discovered over time is our community has grown as our coaches have gotten better, as we've gotten more and more people into coaching, is that the coaching needs are different. So like some people come in to coaching really wanting to organize their life, like, figure out, how to be successful in school, figure out how to manage their relationships, want to learn more about themselves, work on themselves, like boost their EQ. That's what some people end up needing. But what we've really found is that a lot of people who are coming to coaching now are looking to do things that are a lot more career focused. So they want to understand themselves better for the purpose of succeeding more. So we had a high performance pilot where we took people from our community who are high performers. And what does that mean? It gets complicated. And then what we really realized is that what people kind of need is career coaching. So we partnered with Ethan Evans, and we've developed a really awesome educational curriculum for our coaches to help people with their careers. And what I'm going to do today is share with you guys one example of this, okay? Let me just make sure. Okay. So what we've done is, so we had a bunch of people come through coaching. And what we sort of discovered is that there are common problems that people like have. Okay? So when someone says like, I'm struggling in my career, there are a couple of like important perspectives here. The first is that like a lot of these problems are shared. So almost like what we did is took the scientific nature of diagnosis. I don't know if y'all kind of understand this, but if you think about science, we have like the system of diagnosis. And what we do is like break problems apart and then figure out like what works well for each of these problems. So if someone comes in and says, I'm sick, the first question that I'll ask is like, okay, what are you feeling? Like what are your symptoms? Is your stomach messed up? Is your nose clogged? Do you have a sore throat? You know, do you have a rash? Like, what do you mean by sick? And depending on what your problem is, we'll like ask more questions. Okay, my stomach is messed up. Okay, do you have nausea? Do you have vomiting? Do you have diarrhea? Are you constipated? Is there blood in your stool? You know, there are all kinds of questions that we'll sort of tunnel down into. And then as we tunnel down, okay, you have diarrhea. How long have you had diarrhea? Is this a chronic problem? Is this a short-term problem? So there's a very sophisticated method of breaking problems down that comes from medicine. And what we essentially sort of figured out by working with a bunch of clients is that this could be applied for career problems too. And then what we did is we realized like, okay, so at HG, our coaches are very, very good at helping people understand themselves. And there's sort of like internal problems with career stuff and there are external problems with career stuff. And so then what we did is worked with Ethan to sort of understand like how to guide people in a more like job oriented or external way. This will become clear in a second. So what I want to do is just show you guys an example of what our career coaches are competent at doing. So let's start with this. Hold on. Okay. So my boss does not think I'm doing a good job. I'm not doing well. So if we think about this, so sometimes people will come to coaching and they'll say, I'm not doing a good job at work, or my boss doesn't think I'm doing a good job. Now, the first thing to understand is that this problem has two potential options. The first is that you are actually doing a good job, but there's some problem in terms of your confidence, or you have a cognitive bias or things like that, where, you know, like you're actually doing fine objectively. Like your performance reviews are good, but you have anxiety or you have self-esteem problems. So even though like your performance reviews are good and your boss thinks that you're doing a good job, you can come to coaching and you can believe this. So the first thing, this is what I really like about our career coaching, is that our coaches are adept at sort of figuring out, okay, like, is this a confidence issue or is it actually a performance issue? Okay. So then let's assume, for example, like, so this is kind of where we break it down like diagnostically. So then like our coaches are sort of like, they know, okay, so like first thing we've got to do is like, is this accurate or not accurate? So this is where like the first thing that they're going to do is assess your performance. So when you say that I'm doing a good job, let's actually ask questions about things like performance reviews. So what did your last performance review say? Oh, it was great. What kind of explicit feedback have you gotten? Oh, my performance review was good. You know, I got it, so then it's like, okay, that's kind of weird. So does that mean that you're not doing a good job? Do we want to just say, okay, turns out that, you are doing a good job because the performance review said you're doing good. Good job. Adios. That's not sufficient, right? So then we need to understand, okay, what's going on? Where's this person getting this perception? So this is where we've discovered a couple things through data, right? Because we've had 12,000 clients through our coaching program. We figured out is that sometimes there is an incorrect interpretation from a vague piece of feedback. And this is where coaches will like ask you these kinds of questions. They'll be like, okay, what is the exact thing that someone said to you that made you think that your boss thinks you're not doing a good job? Here's another huge thing, right? So if y'all are familiar with the HG's work, you'll be familiar with these concepts. Sometimes it's not that the boss you have a good performance review, but there's a comparison. Oh, but my colleague is doing better, right? So that's why I think I'm not doing a good job. So this is where it's really important, because I'm not doing well at work could be actually a lot of different things. That's your perception, that's your experience, but what's the actual problem? It could be that you have a comparison issue where your mind automatically compares to other people and finds you wanting all the time. Okay? So this is where, and depending on which of these there is, or it's the other thing, right? Which we don't think about in terms of like when we think about our problems at work. So, I'm not doing a good job. Well, why aren't you doing a good job? Well, what does your performance review say? It turns out that some people think they're not doing a good job because they actually avoid explicit feedback. So if I don't think I'm doing a good job, I'm going to avoid any kind of feedback. And then what does that do to my perception of not doing a good job? Because I'm terrified that if I go to the performance review, the boss will be like, you're doing a terrible job. So on the day of my scheduled performance review, I call out sick. And then I come to the coach and I say, I'm not doing well at work. And so as now the coaches like know what kinds of things to ask you, right? And so these are all three very different problems. And none of them are actually like, you're doing bad at work, but we're still going to help you with them. So this is where we can explore things like what was the precise language of the feedback. We can reflect on that and then sort of help you understand that maybe this is like, you're interpreting this incorrectly. Or we're going to dig into a humkar. So this is where like our coaching curriculum really steps in. This is kind of our unique approach at Healthy Gamer, where we sort of incorporate a lot of this stuff into like, external worldly career executive coaching, where we're trained in principles of Vedic psychology. So this is where your ego is active, right? And so this is where there's like a process of like digesting the ego, understanding where the ego comes from. Y'all can find this also in the Atman Pada of Dr. K's guide, well, if y'all are interested in this kind of stuff. So, once there's a misperception, that misperception is probably due to an emotion. That emotion is probably due to a samskar. And then like you get these false rationalizations that convince you that this is true. This is because your ahamkar is weaker than your buddhi. For those of you that don't know what I'm talking about, not that big of a deal. The point is that the coaches know this stuff. So they know how to dismantle your ego, how to understand your ego, how to understand the influence of your ego on perceptions, and can help you work through it. Okay? So this is just the internal path. So this assumes that there's a misperception. But sometimes there is not a misperception, right? Sometimes you did get a negative performance review. So what do you do there? So let's explore the legitimacy of our feedback. Okay, what about the feedback was valid or invalid? Now, just because your boss thinks, so this is another deviation, my boss does not think I am doing a good job. Now, sometimes people disagree, right? Sometimes I, as the worker, I think I'm doing great, and my boss thinks I'm doing bad, and it's unfair. So let's explore that. Is the feedback valid? So if the feedback is valid in some way, like I'm doing a bad job, I really am doing a bad job, there are actually multiple reasons why your boss can be dissatisfied with your work or you're doing a bad job. One is that there's a skill gap. There's actually a lack of like knowledge there's knowledge that you lack. There's something that you don't know how to do. Here's the other reason. Sometimes there's an effort gap, right? Sometimes the reason that we're not doing great at work is because we don't want to. We're burnt out. We're tired, right? And so this is where like each of these things has different kinds of like interventions. So if your problem is a lack of effort, this is where coaches are going to employ certain techniques to help you build motivation. That's completely different from like you're motivated, but you just don't know how to fix this deficiency of knowledge. So there's a strategy to do that as well, right? There are steps you can take to actually address a skill gap. The point is that those are very different things. And it's very important in a sense to diagnose why the feedback is valid. Last reason, I mean, there are more than these, but these are like the really common things, right? Is that there's a style gap, right? Where like I do it a particular way, but the powers that be want me to do it a different way. And it's important to sometimes understand that the problem is actually stylistic, where your boss is unhappy with it, but they may not be really recognizing that there's a style issue going on here, that I prefer it in this way, you prefer it in this way, and we can sort of have conversations around that. You can address that style gap, even involving like a conversation. Now, that's if the feedback is valid. But then sometimes the feedback is invalid, right? Sometimes the feedback that you're being given, you actually are doing a good job, but people undervalue your work. And then there are certain ways to adjust to that. So what's the smart way to adjust to invalid feedback? So like, how can we help a client kind of emotionally accept that even though you're in the right, you may have to play the game at work for a little while and go through the motions to get people off your back, right? This can involve things like, even though it's incredibly emotionally frustrating for you to be unfairly judged, how can we help you work through that emotional frustration, develop some degree of detachment so you can kind of like do what you need to get promoted and get out of that situation, or quit, right? And this is where, people may jump straight from, I'm not doing well, I need to find a different job. And the whole point of career coaching is that by working with tons and tons of people and by leaning on some of the expertise of people like Ethan, who's been, senior at Amazon for over a decade, is that we've been able to sort of figure out these formulas, equip our coaches with these formulas so that these very common problems that people have, the coaches can actually help you figure out like precisely what's going on in your job situation and also guide you in a very like concrete way, right? So what is this? Is this a problem of your ego, or is it a problem of like stylistic differences between you and your boss? Because if you get a bad performance review at work or you think you're doing a bad job, that the reasons for that are like all over the place, right? So if you want to figure out how to fix that, it involves a precise diagnostic approach. And then the last thing, explore significant limitations. So the last thing is that sometimes, despite strengths, we're like very limited in a particular way. And there's like some kind of hard, significant limitation. This may not make a whole lot of sense, but this is where coaches can help clients kind of reframe. If there's a real bottleneck, like how do you overcome that bottleneck? This is not just a stylistic gap or like a cognitive bias, but sometimes there's like a real problem. Like there's a real bottleneck in the way that's preventing you from succeeding. And how do you address that? So this is sort of what career coaching is. This is what our approach to career coaching is. It's this general hypothesis that if you look at people who want to succeed in their career, that there are very concrete, real, and reproducible answers. The reason this tends to be hard for a lot of people is because they don't have the benefit of working with, hundreds or thousands of people. So you can't really figure out like what the diagnostic approach is. And then what our coaches do, like now that we've equipped them with all this, like they can actually be very, very precise in sort of navigating you, helping you figure out, okay, is this like a cognitive bias issue, or is it actually like a skill that you need to learn? If it's a skill that you need to learn, what's the right way to do it? And what I'm really excited about for this program is that this is where I always felt as a therapist, this angle was completely missing. Because therapists, for example, they just know how to do like the internal portion, right? They know like, okay, let's explore your cognitive biases and talk about confidence at work. But a therapist isn't going to be equipped to really tell you like, or help you work through how do I figure out like how to actually like improve my skills in this area. And that's what Ethan really brings to the table, which is like, how do you succeed in a corporate environment? Like, what are the steps? The flip side of this is that if you look at traditional executive coaches, they may know how to succeed in a particular corporate environment, but they're not formally trained in stuff like the ego or Vedic psychology or the ahamkar, or like what samskars are, like how do emotions affect us? And so what we've really tried to do in career coaching is to combine these two elements, right? So what happens if you take someone who is trained as a monk and is a psychiatrist, along with someone who has worked at Amazon, launched Amazon Prime Video, launched a lot of the stuff at Twitch, has risen through the corporate ladder, has done a ton of executive coaching themselves. And if we put together these two kinds of expertise and we educate a group of coaches, in what way can they help people? So this involves everything from like understanding negotiation to understanding cognitive biases in negotiation, and sort of really being educated on both of those sides. So the good news is that we've already run a pilot for this program. The pilot outcomes are very, very good, but small, right? So it's a pilot program. And so now we feel confident enough in this program to where we're launching it. And so what we've managed to do is sort of equip our coaches that we're really confident in the program. Like, I think there are a lot of different issues that people will run through. So common issues are things like, I'm not doing a good job at work, but it's so much more complex than that. Other things that our coaches are sort of equipped to handle are like, it's hard for me to advocate for myself at work, or people play politics at work, or I don't know if I should quit or not. Should I just quit? right? So how do you work through that in a systematic way that leads people to sort of like really strong conclusions and like helps them move forward in a very like discrete way? Even simple things like, how do I distinguish myself at work, right? I'm having trouble distinguishing myself. So there are all of these kinds of like common problems that people have with at work. I'm really convinced that you can develop a system like this where you take each of these problems, break them apart into different possibilities, break them apart into different hypotheses, develop essentially a differential diagnosis, and then use corporate expertise to figure out, okay, what's the right answer? What amount of this is internal and what amount of this is like something I need to change at work? And so that's what career coaching is, and it's live now. So if y'all are interested in something like that, we found a lot of benefit for people who are freelancers, developers, people working in corporate environments. I've done a lot of corporate consulting and stuff like that that kind of goes into this as well in terms of like, knowing what bosses look for. So that's the other like really key thing that we sort of bring in, right? Is like, what is your boss actually looking for? How can you tell what your boss is looking for? How do you navigate a situation where they say one thing and they mean something else? How do you navigate issues where your boss messages you on Friday at 6 p.m. and says, hey, I need you to come in over the weekend? How do you set healthy boundaries? So a lot of these like core skill sets, I think this is the problem, is that we're not taught this stuff. We get thrust into work environments and we know, for example, like how to code, but no one ever teaches us like, how do I tell the difference between legitimate feedback and cognitive bias? If the legitimate feedback is valid, a lot of people just feel crippled by it, right? Because they're like, oh, my boss told me like I'm bad at this thing, period. But the boss doesn't give you like a game plan of how to get better at it. So how do you correct a skill gap? Like, what are the steps, right? Or I'm not motivated at work. Okay, how do you correct an effort gap? Like, that's where some of that emotional work becomes really, really important. And we teach our coaches motivational interviewing, right? That's a big part of what they do, is like help you motivate. And so we're super excited about career coaching. It's launched. So if y'all are interested in something like this, by all means, sign up. I don't know how many spots we have, but I don't know where the link is also. So GG. But hopefully like this will help y'all. And that's our goal, is to really help people like get equipped with some of these basics about, I know it's basics, but like it really gives a lot of value. It's very high yield. And what we tend to find is that people tend to do a lot better, like relatively quickly. So just to set some expectations, our experience in career coaching is that the first few weeks are not actually focused on career. People will come in and they'll like start talking about all kinds of stuff. And then over time, it really becomes career focused, which is completely normal. Because if your coach wants to do a good job of helping you, it's not just a lifeless following a diagram. It's really understanding you. What are your strengths? What are your weaknesses? What makes you tick? What cultivates the best motivation? How can we align things towards you and make things specific to you? How can we make it personalized? How can we take this expertise and apply it to you as a person with all your strengths and all your weaknesses? And so hopefully that'll help. About 50 spots left. Okay. Would you have more insight into the STEM fields? Sort of, right? So when I say more insight, this is why we partnered with Ethan. So I know a lot about STEM fields, or specifically medicine and research, but we have freelancers in the program. We have developers in the program. Like, we've done consulting for those kinds of things. And then we've got Ethan, who ran a team of 800 people. Like, so he knows a lot about, working with teams of developers and stuff like that. So what we've really tried to do is like, because I'm not an expert at everything. And we realize that if we want to do career coaching really well, it can't just be Dr. K, because I can offer that internal piece. But in terms of like how to succeed in a work environment, that's something that Ethan brings a lot to the table, right? Because he's got the bones for it, right? He tells stories about Jeff, which are fantastic, but it's great. So like he's really good at what he does. Okay. All right. So who are we rating today? Are there plans for students, or is that covered more by the regular coaching program? So definitely covered by the regular coaching program, but I think we have recognized that students have different needs. And that's also why we don't just have coaching for our different communities, right? That's why we have Discord. We've got different kinds of YouTube videos for students. We've got Discord communities for students, things like that. And we may develop something more specific for students, for sure, but we don't know yet. Yeah, so we have seen that a lot of students really benefit from group coaching. So yeah, I think a lot of students really benefit from groups. Almost, I want to say, not that groups are designed for students, but we tend to see like really good outcomes in that student population. So that's the other thing that we're doing is we're trying to figure out, okay, if you're a student, what has Healthy Gamer already done that seems to help students? So that when we have students, we know where to send them. So part of the reason that we have, for example, like this, study lobby is that it's turned out that students in our community just benefit from that. Like during finals time, they need some kind of behavioral anchor to get them off of playing a video game. And if they can show up in the Discord lobby and just sign up there, then that's great. And so generally speaking, we also find that students tend to get a lot of value out of group coaching. Also, from a budget standpoint, it seems to be something that like is very affordable for students. So that's another plus. But I think because a lot of students have shared issues, right? So it's like you're struggling to study, other people are struggling to study. And one of the things we found in group coaching is that sometimes when we have a nice homogenous group, it goes really well. It's also interesting because you can also have a non-homogenous group, which can also go well. But we're seeing really good outcomes for students in group coaching. No, we do not take HSA cards. We are not a health service, right? So this is not medical treatment. That's the whole point. I mean, it's career coaching. So it's not medicine at all. Okay. Rating Vansama. Shy Lily. Who are we rating? Did Vansama raid us? Okay. If Vansama rated us, thank you very much. But y'all are catching the end of stream. Bash Bunny. Okay, it seems like Bash Bunny is focusing and doing a Pomodoro. So do y'all want to do that? Focus Pomodoro co-working? Yay, nay? Yes? Okay. Ruin it. Let's ruin it. Okay, so go get some work done, I guess, chat. And we'll see y'all on Friday, okay? Take care. Ruin it. Let's see what happens.